Hello, everybody. Thank you for being here to this special webinar on the launch of HydraActiv. So today I will present you um, the product, the composition, the clinical benefits. So thank you for being present to this conference, this scientific conference. Today we will see as an introduction before presenting HydraActiv, the composition, the packaging, the daily dose, the actives, and the health benefits. I would like to introduce the hydration role, the prevalence of nutrition deficiencies and physiological micronutrients, the importance of hydration. We will go and review the HydraActiv general presentation and also the health benefits based on this specific composition with the physiological role function of physiological function that are supported by HydraActiv, the target population. We'll make a brief focus on sports and senior or middle-aged people during healthy aging. Scientific data on site will be also summarized because sometimes we can also present some data on immune surveillance, for example, and the added value of HydraActiv compared to isotonic drinks, mineral waters, or vitamin well waters, for example. There is a crucial role of hydration. It guarantees our physiological balance. It is involved in practically all the physiological function of the body because the water is part of the metabolic reaction as a product or co-product that is produced during metabolic reaction or is necessary for these chemical reactions. It's involved in energy production, transport, such as blood. It's the main component of blood. It's a vital need. It represents more than 60% of the weight of an adult and 75% of children. It eliminates also toxic substance from the body because kidneys needs to drain this toxic substance out of the body, and water is part of this natural detoxification process. Hydration also helps regulate your temperature. It plays a major role in maintaining the constant temperature that is a vital need also. And it also plays a role in digesting foods, which is also a vital need. So water is also, and hydration is also important for the maintenance of healthy skin and joints, for the normal function of the brain, producing also body fluids such as tears and saliva, and eliminates waste through sweat, urine, and stool. What is the recommended daily intake in terms of water? So we are 2 liters for women and 2.5 liters for men. The total water needs of adults per day are estimated between 25 and 35 ml per kilo per day, and 1 ml per kilo calories that are consumed. The normal water loss per day is 2.5 liters in total, including 1 to 1.5 liters of urine, and the rest is insensible loss from skin, lungs, etc. And we also, for 1 degree above normal body temperature, an additional loss of 300 ml is assumed. We produce metabolic water every day, about 300 ml per day. And food provides around an average 1 liter of water per day. So we need to drink 1.5 liters per day. It's the estimation by EFSA, the European Food Safety Authority, and the need for athletes are specific depending on the intensity and the duration physical activity. So people are at risk of dehydration, children and infants, because also as soon as they are sick or they have digestive issues, diarrhea, they are at risk of dehydration. And because they are not really drinking, depending on the recommended daily intake, the majority of the time they are drinking because it's during meals, but not because they are thirsty, but it's not enough. Elderly people because they don't have the feeling of being thirsty, and because sometimes they have malnutrition, and dehydration can be linked to malnutrition. Athletes because it depends on the specific needs of hydration based on physical activity. Workers and students who do not hydrate during the day. It's just because they don't have the bottle of water at work or at the office, so they cannot really drink except meals, which is not sufficient. So the French people today do not drink enough water according to Craddock study. 73% of adults and 90% of children do not meet this hydration recommendation. So it's important to have this, to reach this recommended daily intake. The symptoms of dehydration, so it's fatigue, lethargy, headache, dizziness, fainting, muscle cramps or muscle spasm, dark urine, dry mouth, reduced concentration, alertness, brain fog, dry skin, and weaker immune system. What is important is that water contributes to the maintenance of normal physical function and cognitive function. It's an authorized claim in Europe, so it's essential to maintain a good level of hydration. And hydration does not mean only water intake, but also micronutrients, which include vitamin, minerals, and electrolytes essential for the normal functioning of the body. So it's really important to have a water rich in this micronutrient, complementary to foods, to provide this, to reach the hydration recommended daily intake and to reach a proper recommended daily intake also of these micronutrients. For example, magnesium is essential to electrolytic balance, energy metabolism, muscle function, nervous system, psychological functions such as stress and anxiety, protein synthesis, and bone health. Potassium is involved in nervous system, muscle function, and cardiac function because potassium is essential to the heart contraction and blood pressure maintenance. Vitamin C is essential for the production of collagen, so for the skin, joint, and vascular health. Also for bone and joint function, energy metabolism, because vitamin C is involved in the production of ATP in mitochondria. Reduced fatigue is also has a beneficial effect on immune system as an antioxidant action, and is involved in iron absorption. Zinc is involved in immune system, carbohydrates metabolism, protein synthesis, and lipid, or more generally, macronutrients metabolism, cognitive function, skin, hair, and nail health, bone health. Niacin is involved in psychological function, energy metabolism, nervous system, and skin health. Biotin is involved in hair, nails, and skin health, energy metabolism, macronutrient metabolism, and psychological function. For the vitamin of the group B, so vitamin B5, also called pantothenic acid, is an essential component of coenzyme A necessary for the production of energy from macronutrients. It's involved in cell repair and regeneration, contributing to tissue growth and repair. It's also involved in the proper functioning of endocrine system for the production of steroid hormones and the transmission of nerve system in the brain. Vitamin B6, also called pyridoxine, is involved in carbohydrate metabolism, protein synthesis, the formation and red blood cells, immune system, energy metabolism, and nervous system. Vitamin B2, also called riboflavin, is involved in energy metabolism, formation of red blood cells, iron's production, skin health, and the reduction of oxidative stress. And vitamin B1, also called thiamine, is involved in psychological function, cardiac function, nervous system, and energy metabolism. It's just to give you an overview of the fact that these micronutrients are really essential to crucial function of the body. So they are essential and important. It's really important to have to reach the recommended daily intake of this micronutrient for proper functioning of the body, physical and cognitive health. So, HydraActiv, what is it? It's a hydration solution rich in vitamins and minerals, supplemented with HydraActiv. HydraActiv, as a reminder, is a spirulina extract, standardized in phycocyanin, which have been clinically tested in 3 clinical studies, actually. It's a food supplement, HydraActiv. So it's a powder to be put in water. So the main benefits will be vitality, energy, reduction of fatigue, hydration, active lifestyle, antioxidant action, immunity support. We will see further more in detail the health benefits supported by HydraActiv. How to take the product? So pour 1 sachet into a powder sachet in 200 and 250 ml of water, mix well, and drink in 1 time. Do not exceed the recommended daily intake, which is 1 sachet per day. It's for adults exclusively because the daily dose of macronutrient in need are really based on the adult's needs. For pregnant and breastfeeding women, seek advice from your healthcare practitioner. There is no proper counter interactions, but sometimes pregnant and breastfeeding women may be supplemented already in micronutrients. It's sold in by 30 sachets, so the consumption will be for 1 month. So in a cool, dry place, protected from light, and in the original packaging. So the composition in active ingredients, we have 300 milligram per sachet of HydraActiv, magnesium, 250 milligrams, representing 67% of the daily recommended intake. 384 milligrams of potassium represented around 20% of the daily recommended intake. It's also rich in vitamin C, 100 milligrams representing more than 100% of the daily recommended intake. It's also rich in zinc, niacin, vitamin B5, vitamin B6, B2, B1, acid folic, which is also called B9, and biotin. For the vitamin B, niacin, biotin, and zinc, and vitamin C, the daily dose represents in more than 100% of the daily recommended intake, so the daily needs are covered for an adult. So, which physiological function are supported by the micronutrients in HydraActiv? Cardiac function and blood pressure by vitamin B1 and potassium. Muscle, joint, and bone health for active lifestyle and mobility. Magnesium, vitamin C, zinc, and potassium for psychological, cognitive health and nervous system. Magnesium, vitamin B9, niacin, zinc, vitamin B1, and biotin. For energy metabolism, and it contributes to fatigue reduction. Magnesium, vitamin C, niacin, the vitamins of B group, and biotin. Hair, nails, and skin health also are supported by vitamin C, biotin, zinc, and vitamin B2. Immunity is supported by vitamin C and zinc. Macronutrients metabolism, which means lipid, carbohydrates, and protein metabolism, is supported by magnesium, vitamins B6, B9, and biotin. And all the circulatory vascular health collagen synthesis, red blood cells, iron production and absorption. Is supported by vitamin C, B2, and B9. So the target population of the product, HydraActiv, the general adult population, health of the skin, energy metabolism, macronutrients metabolism, immunity, and cognitive and psychological function. A focus can be made on athletes and sport nutrition for energy metabolism, macronutrient metabolism, circulation, absorption of iron, cognitive and psychological function, and muscle and joint function support. For middle-aged and senior people, for healthy aging, energy metabolism, macronutrient metabolism, vascular health, cognitive and psychological function, bone, joint, and muscle function, oxidative stress and immunity, reduction of chronic inflammation, and the reduction of the risk of nutritional or micronutrient deficiencies because this target population are at risk. Student and active workers, immunity, fatigue, energy metabolism, cognitive and psychological function, and antioxidants. Because for this type of population, they are at risk of psychological or cognitive, I would say, stress, fatigue, especially, or immunity, or immune depression. So it will also make a focus on this. In terms of magnesium glycinate, which is a form of magnesium in HydraActiv, it is a highly bioavailable form of magnesium. 91% is bioavailable after the first step of digestion at the end of the stomach, and 72% is bioavailable in the small intestine, where absorption in the intestine is made to make the magnesium available in blood and distributed to tissues. So we can see then nearly 75% of the magnesium ingested is bioavailable. So we can say that it's a high bioavailable form of magnesium. There is an efficient absorption of magnesium in this form, which is on this publication is compared to other form. And we can see that it's one of the 5 most bioavailable form of magnesium. I would like just to make a reminder of HydraActiv scientific data. So it's a spirulina extract standardized to 30% of glycosylceramide. It's a water extract with low temperature from organic spirulina. It has 3 clinical studies and 2 preclinical studies. It has an anti-inflammatory action based on the ficosecond fraction, which inhibits COX-2, and non-ficosecond fraction inhibiting 5-LOX. 5-LOX and COX-2 are pro-inflammatory enzymes. So they are responsible of the production of anti-inflammatory agents. And this non-ficosecond fraction and ficosecond fraction inhibits the activity of this pro-inflammatory enzyme. It has no effect on blood platelet and clotting effect, so it's a good safety profile. Apart from the antioxidant action of HydraActiv, there is also a support to immune surveillance support because it will stimulate NK cell, natural killer cells, which is a category of immune cells. It will also reduce the pro-inflammatory leukotriene BCAT migration and stimulates the migration of immune cells. And it will also increase specific lymphocytes. So we can say that there is a support to the natural immune system of the body. And HydraActiv is also clinically tested in 3 clinical studies, 1 pilot study at 1 gram per day, a second, which is a crossover study against placebo at different doses at short term, 250 milligrams and 500 milligrams per day, and the third one, which is the gold standard clinical study, randomized, double-blind, parallel, placebo-controlled study for the safety and general comfort, joint comfort during physical study at 1 gram per day. We can say that there is a reduction in joint pain score during physical activity. At short term, there is also, what we can say also is that, yes, at short term, there is a significant reduction in the pain score for primary pain at rest or during physical activity, and also for the secondary pain at 2 weeks and after 4 weeks. It's even more significant after 4 weeks. And the reduction, continued reduction, and there is a primary pain plateau, probably due to the increased amount of physical activity. At short term, so the first week, volunteers of the study consume 500 milligrams per day of HydraActiv. The second week, nothing. The third week, the placebo, and the fourth week, the half dose. There is a significant reduction of pain during physical activity, whatever the dose is. And there is also an increase in activities of daily living. So we can say that at low dosage, there is also a quality of life improvement. So please keep in mind that at the 300 milligrams per day, it's the quantity of HydraActiv in HydraActiv. We have clinical data at this dosage on the fact that it has an anti-inflammatory action, an antioxidant action, and a reduction in joint pain, and an improved function and flexibility, which allow an increase in physical activity and active lifestyle. I just wanted to remind the link between oxidative stress and inflammation and chronic inflammation. In aging, sport, metabolic health, and joint health, and joint discomfort, there is a chronic inflammation that will increase synovial inflammation, immune cell infiltration in tissues, especially joint, but other tissues. And it will also increase and contribute to oxidative stress. This oxidative stress will also increase chronic inflammation, activate MPP, metalloprotease, contribute also to DNA and protein damages, control side apoptosis, photoglycan and collagen inhibition. So please keep in mind that it will increase inflammation, and inflammation will also is linked to oxidative stress. So based on this micronutrient and HydraActiv, we can participate to it will participate to the reduction of oxidative stress and chronic inflammation. HydraActiv is also important and can be also beneficial in terms of sport nutrition. The benefit one will be for macronutrients metabolism, energy metabolism, and reduced fatigue linked to the physical activity, because the needs for micronutrients, for micronutrient, the fact that we consume energy, protein, carbohydrates during the physical activity. So it's a support to this by magnesium, B6, B9, and biotin. It will physical activity will increase the microcirculation the circulation, I would say, speed. It will promote the transport of nutrients, immune cells, stem cells to the tissue, and the oxygen, which is really required all along every day, but also increase during physical activity. So vitamin C, B2, and B9 will support this vascular health, reduce oxidative stress, and its associated muscle and vascular damage. The benefit 3 is to the support of bone, joint, and muscular function during physical activity with magnesium, vitamin C, zinc, and potassium. And to limit oxidative stress and chronic inflammation, there is also HydraActiv and vitamin C during physical exercise and during recovery. During aging, it's also important to see that there is an increase in oxidative stress. There is an immune senescence, so an aging also of the immune cells, and chronic inflammation and microcirculation alterations. So also HydraActiv can support these 4 functions that change and can be entered during healthy aging process. So as a reminder, HydraActiv is for the general adult population, and there is a focus on sport nutrition, healthy age, and students and active workers. Benefits. The other thing I would like to tell you to finish is the fact that I compare HydraActiv composition to isotonic sport drink, just like Isostar, mineral waters, 1 liters, and vitamin well waters. It's a it's a drink with enriched in vitamins and minerals. And HydraActiv contains more magnesium than isotonic drinks. Is highly available in terms of form of magnesium. Calcium is generally provided by foods. It contains more potassium than mineral waters. It contains more than vitamin C, zinc, vitamin B9, biotin than vitamin well waters, and contains also B1, B2, B6, niacin compared to vitamin well waters, and contains 300 milligrams of HydraActiv that are not present in the other product in the market. And it's also clinically tested between 250 milligrams and 1 gram, which is coherent and consistent with the daily dose in HydraActiv. So it's just to give you also arguments to promote the products compared to the product in the market and some potential question you may have. HydraActiv can be also complementary to stem enhance, which is a stem cell mobilizer to support tissue repair and tissue renewal, and it also support immune modulation. So both are really complementary. So stem enhancer can be taken 2 capsules per day. In the morning with 1 sachet per day of HydraActiv and 2 capsules of stem enhancer in the evening. So I thank you for your attention. If you have any questions, please on the HydraActiv, send email to the customer service of Several, and they will also forward the question to me. Thank you very much. Bye-bye.